I am here today to speak in strong support of H 1687, an act requiring healthcare employees to develop and implement programs to prevent workplace violence. For the nurses at the Brigham, the issue of workplace violence has a real, recent, and traumatic history for our staff in the wake of the tragic murder of one of our most respected and admired surgeons last January. One would think that such an incident would spur immediate and comprehensive action by the hospital to take every step necessary to protect its staff and address any and all concerns to minimize the risk of this ever happening again. You would think I would be here today to hold up the Brigham as the poster child for workplace safety and the prevention of workplace violence. But sadly, as you just heard from my colleague, Liz Dalton, this is not the case. I was working on January 20th and heard the shelter-in-place announcement. When the announcement first came over the PA, many did not know what shelter-in-place meant or what to do. Brigham and Women's Hospital has over 40 operating rooms, and the majority had patients with surgery underway. We were told to lock the doors, but in my area of the OR, in spite of the doors having restricted areas posted on them, the doors to the orthopedic trauma operating rooms locks were disabled and broken, and remained broken for many weeks after the shooting. Word got down to us that there was an active shooter. You can imagine the fear. Being in the operating room, we continued to work on our patients and also prepare for possible incoming victims. We then heard someone was shot and that it was one of our own, Dr. Michael Davidson. He was brought to the operating room where his friends and his colleagues courageously fought to save his life for close to 10 hours. But as you all know, their efforts were not enough to save our friend's life. That day and the following, I was contacted by multiple media outlets who wanted to talk to me about security concerns at the Brigham. I informed them that at the time I would have no comment out of respect for the Davidson family, and also because I had reached out to the Brigham administration asking that they sit down with myself and the M&A Brigham Committee in the near future to discuss the events of January 20th and hopefully strategize on how we could work together so that although we may not be able to prevent all acts of violence and terrorism, we could work together to make it harder for someone to do it again. Unfortunately, the assault described by Liz was not an isolated incident following the tragic events of last January. Other nurses have been subject to threats of violence, physically assaulted. Just this past weekend, 2 nurses were attacked by a patient, one so seriously that she was admitted to our emergency room. And we have identified a number of risk factors in our hospital which are not being properly addressed, including the lack of secure doors and procedures to prevent the inappropriate access of potentially dangerous visitors, the lack of adequate training and education of staff, fragmented and inadequate policies and procedures to prevent and respond to workplace violence incidents, and a total disregard by the hospital for the input of frontline nurses in this process. Specifically, the hospital's rejection of myself and my colleagues to have a role in developing a plan to address these concerns. In fact, after being told by members of nursing leadership that they did not have to speak to me or the union in regards to security, shortly after a number of serious incidences at our hospital, including the assault Liz just described, I reached out to the newly named COO, Dr. Ron Walls, the chief administrator overseeing security issues at the Brigham, hoping to begin a dialogue and process involving the nurses and hospital management to ensure a safe workplace for all. Unfortunately, this overture to work together on a plan to address workplace violence and security issues was rejected. As I mentioned, there now have been several serious incidences that have happened since the murder of Dr. Davidson in January and the assault of Liz in April. 2 I will quickly share. One happened on one of our Dana-Farber oncology floors. A man approached one of the nurses. The man angrily asked the nurses if she knew him. The nurse stated that he looked familiar. The man said he should look familiar because the Brigham had killed his wife. He had a doctor's card and demanded to speak with the doctor. The nurse backpedaled to nursing desk in hopes of activating the panic button that would notify security silently and hopefully avoid escalating the man and notify security that there was a serious security event happening on the floor, only to find the panic button was non-functional. The man continued to yell and berate the nurses and then stated that the doctor had been prank phone calling the man at home for months, which was even more alarming, speaking to the possible delusional state of mind the man was in. Another nurse was able to get to the phone out of sight of the man and call for help. When security arrived, they did escort the man outside of the hospital. The alarming issues, besides the fact that the panic button was not working, was that after the man was escorted out of the hospital, there was absolutely no communication to staff or plan by management as who the man was or what to do if he repairs on the floor. The story is eerily similar to the events that led to Dr. Davidson being shot. The other incident took place in my area of the operating room. It happened several weeks ago. All of our over 40 operating rooms were operating on patients at the time. One of the nurses came out of the OR to get some supplies, and in the hall directly outside a half-dozen operating rooms with patients in them, there was a man in street clothes rummaging through supplies. The nurse called for help. The man was a psych patient who had recently been discharged from a different hospital for depression. He was disoriented and confused. He had gained access to the core of the operating rooms through multiple, we believe, restricted doors that should have been locked. I shudder to think of what could have happened if this man had a weapon or had been determined to do harm that day, since the patients were under anesthesia, undergoing surgery, with on average 6 to 8 staff of doctors and nurses in each of the over 40 operating rooms, who would have been totally vulnerable to an attack, either it be by a weapon or the man attacking any of the staff operating on the patients during surgery. In the wake of management's refusal to heed our concerns, it was our union, with the guidance from the M&A Division of Health and Safety, that filed a complaint with OSHA, filed appropriate police reports with the Boston Police, and reviewed and raised a number of specific concerns about the hospital's policies and procedures that spurred any effort by the hospital to take actions or to mitigate some of those concerns. Had we not taken these steps, nothing would have been done and no changes would have been made. And even then, the hospital failed to adequately address many of the issues we have identified. What is clear to me in the M&A is that absent of a law to require adequate prevention planning and requirement to implement that plan, this hospital and other hospitals are reluctant to take the steps needed to keep their workplace safe. Yes, OSHA has guidelines, Joint Commission has guidelines, the American Organization of Nurse Executives has guidelines, and but guidelines are not mandatory, and hospital administrations are not required to follow them. If this law were in place, the issues we identified as safety risks would be addressed. More importantly, if this law were in place, we would not have to file a complaint, and our management would not have been allowed to reject our involvement in the process of identifying and addressing risk factors for violence. This bill guarantees that frontline workers and employee unions like ours have an equal voice in determining the policies and procedures to ensure a safe workplace to prevent workplace violence. And if those steps are not taken by the employer, staff in the union have the authority and process to ensure their concerns are heard and heeded. While we can't prevent every tragedy and every assault, we can prevent many of them. As nurses who give so much to keep our patients safe and healthy, we should expect and deserve to work for employers who are committed to ensuring we are safe. This bill will do just that, and I urge the members of this committee to approve this legislation to protect and care for those who, as we have seen at my facility, are putting their very lives on the line to protect and care for you. If we, the nurses and other staff, are not safe, then you are not safe. I would say to everyone here who's been here for every bill that has been stated here today, ask yourselves, all of you, you've either been a patient, you've had a family member, someone you know have been in a hospital and you visited that hospital. Like I say, if the nurses and staff of the hospitals aren't safe, then needless to say, neither of you. We are depending on this committee to help us to keep ourselves safe. Please consider passing this bill.
Thank you very much.